Hello, good afternoon.
Hello, afternoon.
Let's see, I think Erna just joined.
Yeah.
Hi.
Hi,
Oh,
Liz.
you made it.
Afternoon.
Yes, good afternoon. Can you hear me?
Yeah, loud and
Yes.
clear.
Yeah. Okay, that's good.
Should we wait a few more minutes before we can start?
Yeah, sure. Brunei time, 3 o'clock.
Yeah.
It's 3 to the... yeah, okay.
How's everyone?
I'm fine, Dr.
Doing good?
Teo. How are you?
Yeah.
All right. I just saw the viral messages about everyone wanting a vaccine.
Oh, yes. Fully
Yeah,
booked.
yeah, fully booked and it's so crowded. Maybe everyone's there and we're the only ones here today.
Yeah.
I saw the video also from MOH staff
Yeah,
and then saying like if they want to come in, it starts next week, Friday.
yeah, it's
Yep.
close. Yeah, I think it's fully
Yeah.
booked. I think it was full since like before noon. Yeah,
Yes.
Yes.
yeah,
Yep, you're correct.
Really long queue.
yeah.
Mm-hmm. Oh, me. Somebody is
Yeah, my friend.
acknowledging you.
Yeah, my friend is joining
Thank
the
you for
live. Thank you.
joining. Yep. Mm. Are we starting?
Yeah, Ken.
Should we
Sure.
start?
Yeah,
Yes,
sure.
please.
Okay. Assalamualaikum and good afternoon, everyone. Welcome to our final session of our weekly online discussion. I'm Umi as the moderator for this session today. And here we are with our distinguished speakers, Dr. Teo and Ms. Irnawati, which will give their insights and knowledge about our topic today, which is the behavioral and psychological symptoms of dementia, or in short, BPSD in dementia. Our speakers will explain what BPSD is all about, the symptoms, the factors contributing to BPSD, and so on. So, without further ado, Dr. Tia and Mr. Na, the floor is yours.
Thank you so much.
Okay.
Should we probably recap first about what we've gone over in the last few weeks? I think there's been quite a lot of information, so probably let us go back and summarize a little bit. I think we did talk about what is dementia. It's a brain disorder or a disease which is progressively getting worse and it affects multiple parts of the brain. And then we talked about how to overcome or reduce the risk. And then in terms of seeking treatment, it's very important to be aware of the diagnosis and seek medical attention. Then I think there was a discussion about communication and strategies on how to communicate with people with dementia. And then I think last week it was a lot more practical aspects, things like activities of daily living and how to keep them a bit more occupied and how to make the time more enjoyable and productive rather than a stressful one. So today's session is probably one of the more, I'll say, a bit more sad aspects of dementia. It's one of the advanced stages of dementia, complications. So behavioral and psychological symptoms of dementia is one of the complications where people usually have stress or angst over this because the person with dementia has behavioral issues. I mean, like we've all probably seen kids who throw tantrums and their behavior is not as good as we had hoped. But this also happens in people with dementia. Usually it's because of the process of dementia itself, where part of the brain is affected, as well as the interaction with the environment. For example, I'm sure we're all angry at certain things. I'm sure there's some things which we get frustrated over, but our frontal lobe, the part of the brain which gives us self-control, it says, oh no, hold on, let's not hit everyone out. For example, if I was at the indoor stadium late today, I'd probably be irritated. And then all these people are over here, rather than, I want to go to the front, but there's rules, let us try and behave ourselves. That sort of thing is what the front bit of our brain does. And so for people with dementia, that they may be a bit more impulsive, they have less self-control. And sometimes when we get frustrated or these frustrating things happen to them, they act out in a way. And so there are a few things that we need to be aware of. The first one is when they act out, they can't help it. So I want you to think back about what makes you angry. I don't know whether you guys want to share what makes you angry or frustrated or maybe scared. You know, all these emotional things, we can control it. But people with dementia can't. And so they really act out what they are thinking in their mind. So one of my colleagues, she says, people with dementia are very honest. There's nothing to hide. They will just say things as is. They will act out as is. And so you're seeing a genuine person, and you just have to make do with what you have. Yeah.
Yep.
Anything else you want to add, or should I cover the different types of BPSD?
I only want to I like the way you said just now that diorangan ni genuine people actually. So in that sense, although ketani inda faham kanabis diorang atu kan why they are acting that way, but they are actually telling you something. Okay, since last 2 weeks we were talking about communication. And what is supposed to be in our mind, not only the verbal communication daripada the patient yang dementia ni, but actually like us, normal people as well, we actually communicate with people using our non-verbal cues. So for me, kalau sekiranya orang yang ada dementia ni, they are actually telling us something, you know. And kalau sekiranya they are in the advanced stage tah lagi, it is something that we, what we call ourselves as normal people, we should look for, you know, and we should actually appreciate. Kalau sekiranya they are, I know it's not easy lah like I have a 4-year-old kid. Kalau ia tantrum, kalau I know that he wants something, then it will make myself easy lah macam tu, that I can give what he wants. Tapi with a person with dementia ni, it's something different. Tapi having them to have shown their tantrum, shown their behavior, sebenarnya it's a way of them communicating to us that something is really not, you know, something is bothering them. Okay, so I like that, Dr. Teo, because yes, diorang atu genuine, bukan macam ketani we are normal tapi pura-pura tani, you know, that's something in the bisai lah, you know. Tapi yalah, we should look into whatever they give us sebenarnya. We should appreciate that, and it's a way for us to be a bit more open-minded and also creative. Yep, I just want to comment on that because I like it a lot. Yep, I think you can continue, Dr. Teo.
So I just want to emphasize that when we try to act out or we have a response, like you say, it's from the wrong environment. But remember that people with dementia, they can sometimes get signals or messages wrong.
Yeah.
So for example, like one of our patients, for example, the wife said, oh, he seems to be quite aggressive to her. Aggression is one of the behavioral and psychological symptoms. And then it was like, oh, he's usually a nice person. Then he suddenly hit out at me, and then she's a bit injured lah. So what happens is, then we have to ask why did that happen? We have to ask a bit more about what the cause or the reason for that was. And actually what he said shocked me a bit. He actually has visual hallucinations. So he saw a monster.
Oh.
which
Oh.
is the which is covering the person's face. So he didn't recognize it as his wife. So fair enough, if you're lying in bed, you're in your own bed in your own house, then suddenly you wake up, it's not your husband or wife or your kids, it's monsters. What would you do? You'd probably freak out, you'd probably be agitated as well, right? And so,
Yes, I'll hit that person.
yeah, so probably would probably I don't think it's just you. We'd all respond in the same way, taking into account what messages they get. Yeah, so we sort of have to figure out why the trigger is like that, and we have to try and reason with them and figure out how to avoid those things. There was another time when I was called for someone who, this is again a hospital setting, where this person is shouting at people. He is sick with a chest infection. This was overseas, my first dementia patient that I met as a doctor. So he has a chest infection. He needs a mask. He's very hard of breathing. Then they try to put the mask on it. He'll hit out. He will take out the mask. And then we have a caregiver who we can hire to be with him to make sure he's okay. He's shouting and throwing things at her. And then oh my God, this man is so aggressive. When they check the blood pressure, he punches out as well. So one of our staff got injured. So what happens was they asked me to see him. I was in geriatrics. It was one of my earlier patients and consults. And then so what I did was I asked him, why are you here? And he's like, I don't know where I am, he told me. He said, I'm not in my house. I don't know who brought me here. And I don't know why I'm so uncomfortable and I have this anxious feeling. Then I told him, you actually have a chest infection. You pull out your mask. Of course, the oxygen level is low. He's like, oh, so what is that? And then I said, it's a mask. It's to help you breathe. He's like, so I should put it on then? And I said, yes. So he thought because of his breathing problem, something covered his face. It's very hard to breathe. And then he didn't know he was in hospital. So all these people who check blood pressure, stick something sharp in the arm for blood tests, he was agitated with that. So for example, like if I didn't know Erna, and then I suddenly go there and then poke her with a needle, I think she'd also punch and hit me, right? Yeah, so we told him, actually, we're just monitoring him. So we're going to check you, is that all right? And then he was fine with it. He behaved quite well. Then I said, why are you shouting at this kind lady who's at the end of the bed? He said, oh, I'm a bit scared to sleep. I don't know who she is. So I'm afraid what happens if I close my eyes? What will she do to me? And I was like, no, she's here to help you. You can ask her if you need help. Then he said, oh, she didn't say that. She's there looking at me the whole time. I'm like, oh my God, if someone, I'm trying to go to sleep, just come to my room and then look at me, I wouldn't sleep too. I'd be quite upset. And then I told him, because of your illness, it's probably very difficult to remember things. You're struggling to breathe, so just rest. And then because it's very hard to remember these things, should I write down that you're in hospital and give you some orientation? And he said, yes, I'm getting a bit forgetful. I don't know why the last few days. So I wrote on a sign. So while he's lying in bed, there's a board, and I wrote down, you're in hospital, we're treating you for a chest infection. This lady's name is so-and-so, you can call her to help. Next day, new man, no aggressive behavior. He's like, hi, I know I'm in hospital. Who are you? Oh, yes, you're a doctor. Oh, yes, you're a nurse. You're here to check my blood pressure. Oh, yes, I need help to get up to eat. Then he changed man. And then what medication you give him? He's very new. He's like a totally new person. I said, no, nothing. We just have to communicate with them and try and figure out what caused them stress. Because with these signals that they're getting, misunderstanding, there's hallucinations, I'm a bit disoriented. I mean, if we're lost, suddenly, like when we go traveling, I don't know whether you all have been lost before, very frustrating. And then you'd be easily irritated. Yeah, so they're just responding in an appropriate way, actually.
Yeah.
In terms of behavioral and psychological symptoms, there are a few different subtypes. So we've talked about aggressive behavior. Sometimes it's they don't sleep as much is one of the BPSD symptoms. Sometimes they have day-night reversal. So I know people who say, oh, my mother has dementia, and then she's asleep the whole day. Then she wakes up at 2 a.m. She's suddenly tidying up the house. She's doing all sorts of things. And it's like, oh, the change in day-night reversal is one of the symptoms. Sometimes they don't interact well in public. Sometimes they have apathy, so they'll hide in their room. And then you're like, oh, your family members are here. What are you doing? It's like, no, I don't want to see them. Or they just quiet, or they're shy. But actually, thinking back, we would also be the same, I think. I mean, if you suddenly join a group and then you don't know anyone, I don't know who would be outspoken, suddenly can talk so much, right? Yeah. Then what else is there? Wandering. I know there's a few of my clients who will leave the house. One of them is quite active, and he probably doesn't recognize where his house is, so he probably wants to find his way home. And then some of them are just bored. I mean, now with COVID, we're all bored, and we all want to go out. And so for them, they're like, I want to go out, I'm going to do this. So we just have to take that into account.
Yeah. Before that, Dr. Teo, Umi, what is the time for Asar?
3:22.
Okay, so we're gonna stop for a while later, huh?
Yeah.
Okay, Dr. Teo, I think you can continue. Mesmerized sudah.
You got 4 minutes left.
4 minutes.
Yeah, so with these behavioral and psychological symptoms of dementia, I think you have to think about three main things. The first one is it the dementia process, and how do I make sure the person with dementia is able to be oriented a bit more so that they get the same message that we're saying to them. Sometimes when you talk to, I think Erna has teenage kids as well, sometimes when you talk to them, the message doesn't go through, and actually their cognitive function is good, right? Sometimes we just choose not to listen, or we just...
Correct. Sometimes they just need a different language, you know, and you have to like adapt to their slang, you know, their culture, babe, sis, you know, things like that. I think it will be similar to those having dementia. Carry on, Dr. Teo.
How do you adjust to your teenage kids when you say you have to adjust?
I think because having a person with dementia actually is no different from having other people. You know, having a family, having them is not something yang menyusahkan. We have to see it that way, because they also don't want themselves to be like that. You know, and for communicating with my eldest kid, you know, young teenagers sudah, the way I adjust is we have to accept who they are. And then I've been a teenager before. Maybe I feel like I'm a teenager yet. But for me, because we have to respect orang itu kan. And then especially yang ada dementia ni, I have to say this again and again, because they did not pray they would have this disease. Nobody pray, God, please give me dementia, I want to be demented. You know, they don't pray for that, but it happened. So us people, I mean, we as the normal, you know, people, so we have to adjust to their needs. So meaning to say, kalau my eldest, macam mana I speak to him, because this is his personality. My second, this is her personality, you know. So it is us who actually adjust to macam mana kan speak to them supaya the message itu sampai. So it's the same. My understanding of orang yang ada dementia ni actually sama bah macam kita ni bah. Even normal people are hard to talk to, you know, something like that. So ketawa Dr. Teo. Pasal it's really true. Sometimes we say this, yang ia faham lain. And then now we have WhatsApp. sometimes what's in the WhatsApp, we say it in a different tone, but people read it in a different tone. You know, that's how it is. Tapi yalah, for me, because they don't want to be having dementia, so what we can do is we adjust what we can do for that person. So for me, there's just no reason macam Ketani memang stress lah, ha? It's not easy, but we cannot give up on habis orang. It's the same. Macam for me, it's not easy to handle 3 teenagers and 3 younger children, but it is my challenge, you know. So one thing is we have to accept them of who they are, and the way we approach them is we have to adjust in accordance to the situation as well. Sometimes the external environment actually plays an important role, you know. Kalau sekiranya ia stress ke apakah, we can bring them to a place that ia punya ambience satu is better, having aromatherapy and so on. Okay, Azan.
Okay, thank you, Nutrition. We'll have short about 2-minute break for Azan. So in the meantime, our audience, you may post your question in the comment section below. Thank you.
أشهد أن لا إله إلا الله أشهد أن لا إله إلا الله أشهد أن محمدا رسول الله أشهد أن محمدا رسول الله حي على
Sarah.
حي على الصلاة حي على الفلاح حي على
Okay, Alhamdulillah, we're back. And for those who just joined in, our topic, welcome. And our topic for today is behavioral and psychological symptoms of dementia. Dr. Teo and Ms. Nana, you may continue.
Okay. Dr. Teo, sikit lagi ah. Because tadi you already mentioned about kalau BPSD itu it indicates a behavior associated to a dementia patient person. Tapi as you mentioned juga it is actually categorized into kan tu because one is diorang punya behavior and then the other one is the psychological symptoms okay. So for me because we were talking about how do I communicate and adjust myself with my teenagers kids for me kan first of all kalau sekiranya we have a family with dementia ni first of all we cannot give up lah as I mentioned tadi, and the second thing is jangan ketani kusut, you know, you understand kan Dr. Teo kusut like
What's kusut?
kusut is like macam we are feeling frustrated as you mentioned tadi. If we feel that already, it will mengganggu lah. It will be macam ketani pun karang kusut te jua, ketani kusut. Then how we approach diorang pun it will be different. Okay, so meaning to say we have to be very patient. We have to be very open-minded and jangan kusut dulu. Okay, kalau tadi kusut, it will always be, they can see it. And then it's like how we approach them pun, it will be different. So this will affect lagi diorang punya thinking. Macam tadi kata Dr. Teo kan, rupanya ia cematu kan pikirnya, monster. Sedangkan yang tidur siringnya ni is, ia punya spouse. So, I mean, kalau somebody comes up to me, having that, I cannot recognize macam tadi the nurse, okay, because dia datang sejabat without introducing apa, obviously I will also be scared, you know. So there must be reasons why they are behaving that way. Yeah, macam tu lah. You nak continue?
I wanted to go over some of the approaches for people with dementia, I think, because I see there's a few questions which we have to answer. So I think there are a few approaches. The first one is, I think all of us, like I say, have the potential to be a bit irritated. And there are a few times where that is worse. The first one is when we are hungry or hangry.
Angry.
Yeah, and the other one is, one asked the question, why do people with dementia get worse at night? So when we're tired, we're more irritable. When we're tired, we can't think as well. So then, of course, all the symptoms of dementia, which is the brain struggling already to work, you're tired, it will be harder for it to work. So all the symptoms will become worse at night. Or when we're tired, actually. So my approach for people with dementia, especially when I see them, is make sure that at the best state they're in, make sure they have eaten, make sure they have drank, so eat, sleep, bowels and bladder, because I know like if you're busting to go to the toilet, I think all of us will be sitting around comfortably like this in the conversation, will all be irritated, when will this be over, sort of thing. So bowels,
I'll disappear.
Yeah, and then if we had no self-control, we're probably gone. We won't be waiting for permission of this to end, right? So eat, drink, cool, sleep is important. And mobility and cognitive stimulation is important. So if you sit for so long or you're bored, I'm sure I saw you had your son there, is it just now? He's around.
Yes.
Yes. So if you ask him to sit there for 3 hours on a chair doing nothing, I'm sure he will throw a tantrum and then get irritated, right? So you have to sort of make sure they're a bit more comfortable. There's something to do, that sort of thing. Then, if you notice that a person with dementia is getting more irritated, we actually have to think why that is the case. And sometimes for advanced dementia, we try to figure out a pattern so that we know what is irritating them, because sometimes they cannot tell what is irritating. I mean, it'll be easy for us to say. We'll be like, oh, I don't like this, or the food's not nice, or why is it so hot? But people with dementia, they cannot say that. So I think one of the poor patients, just too cold. So in the hospital, they're just hiding under the blanket, no interaction, no nothing. One person got irritated because it was hot, and then after the family bought an aircon, then the person's a bit more relaxed and less irritable. So you
Oh.
think about how to reduce the irritability. Then in terms of patterns, I think all of us get irritated with certain things. So you need to know the person's background. So for example, like, I don't know how to say this. I'm sure we're all irritated with certain people. Do you know what I mean? Like when that person comes, you're already like, oh, it's this person again. I don't know whether you have that.
Roll your eyes. Oh.
Yeah. What happens is it's the same. So very low threshold, that person says a little bit with good intention, we still get irritated, maybe. So it's the same thing. So we all have certain pet dislikes. It can be things, it can be people. So we sort of have to find the pattern. It's like, oh, maybe they just don't like this. Let's try to remove that from their surroundings, for example. Then optimizing the signal going through is important. Things like wearing glasses, if they can't hear, hearing aids. So it's very frustrating if you can't see. I think 3 of us are wearing glasses. So if no contacts, and then I could put you in the Murong town if you haven't been there. Very irritated. I'm sure you'll be very frustrated as well and act out. Yeah. So we have to try and optimize those things. Yeah. And then we've talked about how to communicate and keep them entertained. Sometimes when we get tasks which are too difficult, we also get irritated. So the person's dementia and their limitations, we have to try and figure out how to engage them a bit more. So for example, if you can't cook, then you have to break it down to little steps. I think Emily covered that you have to have everything there. You need to break it down to little steps. And we take things for granted, like just drive. But if you ask 18-year-olds who just learn how to drive, not easy. You have to do, I have to do this, I have to do that first. And then so breaking down into little steps help. And then if you say to an 18-year-old first time in the car, you just drive easy. And then after that, we want to assess you. It's not possible. And that person will be quite frustrated because it's already quite difficult when it's a new skill. So you just have to tailor the activities to their ability, and you have to make sure it's something they like doing. So for example, one of my dementia patients comes to see me, and I said cognitive stimulation is good. So you have to give them activities to keep their brain active. Then what happens is the poor person got frustrated, and then the daughter told me, no, when I try to get this person to do cognitive stimulation, they act out, they're very angry, they always throw the books at me. And then so I asked, why are you not engaging with this? The person doesn't like crosswords. So the daughter gave crosswords, and then this person just doesn't like it. And then so daughter says, this is good for you. You should do this every day. Every day, 8 o'clock after breakfast, you need to do this crossword. So it's like, so of course the person's frustrated. So I say you actually have to tailor it to the person as well. So I cannot give a recommendation which will work for all dementia patients. We have to know a bit more about the person.
Yes. Yeah. I agree with that, Dr. Teo. Pasalnya macam we cannot like generalize that everything can work for every dementia person. Because even with the single person jua, kalau today it might work, tapi maybe tomorrow it might not, you know, because we don't know what is that person actually feeling, especially kalau sekiranya there are unmet needs atau like you mentioned tadi, this will actually mengubahlah cara ia punya behavior. So I would like to also share probably Dr. Teo and also the viewers here, tips that we can actually pakai lah with our family yang ada dementia. Because but one thing we have to remember is in our mind again and again we would encourage people to be patient. The only word is just sabar lah. We have to be patient and we have to keep our mind open. And as we mentioned tadi jua, one thing that we did today can work, but a split second later it might not work as well. Pasal dorang tu can't remember yang apa terjadi awalan ni. They can remember what happened 20 years ago, but yang masa ni they cannot remember it. So we don't get agitated and frustrated, and we don't actually react teruslah in that situation, because one thing, if we react terus and then we become angry ourselves, then kusut, as I mentioned tadi Dr. Teo, then ia pun kusut, you know, because kalau kita ni in the kusut. So, okay, if ia show tantrum, for example, we don't understand yet, okay, so we back up first, okay, jangan dulu approach ia instantly, unless ia in danger, okay, unless ia can fall ke apakah, then we have to run, okay. But kalau yang lain, ia duduk-duduk sekali ia feel agitated, tiba-tiba ia marah, we approach in a way that ketanya tu bukan approach in front je Dr. Teo and also correct me if I'm wrong. Pasal kalau sekiranya we approach and then we angkat tangan, probably ia takutlah because maybe ia dah recognize us, or maybe the person yang want to approach is actually ia dah suka. Okay? So with them it's banyak possibilities. So kalau sekiranya ada episodes, then the way kita ni approach is we approach them perlahan-perlahan. And don't put up our hands macam kita ni put up our hands, takut tu ya, you know. So we have to approach from the dominant side, biar diorang comfortable. And then jangan raise our voice lah. Kenapa Dr. Teo? Macam tu, contoh. So we have to approach bisai-bisai lah macam tu kan. And then the important thing is that we need them to know that we are communicating with them. And the best thing to do is, kalau sekiranya ia duduk, we have to kneel up to the level, and then we speak to that person eye to eye level, supaya ia dapat listen to us more and focus to us. That's at the moment. So for me, that is a good tip. And then one thing again, we do not raise our voice, and also we don't actually argue with them. Okay, so once we argue with them, the whole process won't actually work. I think this boy is So look at him. So meaning he wants something. So sama je macam orang yang ada dementia. So whenever he approach you, that's a good sign. So that is when you take the opportunity and ask what actually is happening, you know. Kalau sekiranya ia punya mood masa itu is a bit sedih-sedih, we can ask, okay, do you have anything to share with me, you know, something like that. And yeah, we don't raise our voice and then we don't argue. Kenapa kita macam ni kan mak? Tadi sudah aku macam ni, you know. So if we argue with them, obviously they won't accept us. And then they actually pick up diorang tu. Macam how we approach diorang tu. And you know, the kusut thing, or maybe we don't say anything but our face, you know, things like that. So they pick up on that. And of course, kalau sekiranya we as we see somebody like that, we wouldn't, you know, actually mau that person to be helping us anyways, because we would feel macam we are menyusahkan that person. If sekiranya it makes that person sad, we don't want to do that, you know. We want people benar-benar helping us, and then we in the mau, you know, to actually start something else like that. And then one interesting thing yang tadi tu Dr. Teo and also the viewers, kalau sekiranya ia duduk, kita ni have to kneel down and up to the level. Kalau sekiranya we stand up and then bercakap sama ia, so it's sometimes ia indah dapat melihat kita ni as how we want that person to see us. Tapi kneeling down is meaning to say we are here for you. Sometimes you have to have a bit of touch lah juga to comfort them. Babu, kenapa babu? You know, something like that. Do you need anything, babu? We have to have words yang simple. Ani juga Dr. Teo, one thing, we don't raise our voice. okay, for the viewers. And also we say things as few as possible. Kenapa babu? Simple word saja. And then pelan-pelan, jangan laju bercakap. Kenapa kita buat? Tadi kulit kita okey jua. Ni kenapa kita cuma ni? You know, macam you know, that will translate. So that person might not understand it. So kita ni perlahan-perlahan and try not to overwhelm. Okay, kalau terlampau banyak, karang bawa kita macam ni walaupun perlahan. Karang kita macam ni bawa, karang lepas ni, ani. So it is overwhelming. Okay? Yep, I think and also kalau sekiranya for example, we actually have to acknowledge what they say. Okay? So we have to restate what they say. Sekiranya we go to the level, babu kenapa babu? Lapar babu. Oh, ia tanya, tadi macam babu belum makan. Oh, babu belum makan. You know, things like that. And then we ask lah, babu belum makan. Babu kan makan apa? Macam tu. So we have to restate what they say. So it's a validation. It's an acknowledgement yang we are actually listening to them. Okay? And then we are doing for the best interest for them. And then kalau sekiranya macam we don't understand why they are acting that way, we should play detective. So we should look at the common reasons why they are like that. Why are they are upset? Oh, dulu ia upset because ia ni tidak suka makanan ni. Things like that. Alright. As for now, itulah, those are a few tips that I can share, Dr. Teo. And for the viewers as well.
I think that experience is quite useful actually. I think they are quite, we take for granted lah. I mean, I think if you see over someone or you're bigger than them, you feel a bit more intimidating. And then also do your technique of going to their eye level. Then it's a bit less like I'm telling them off, because if I stand over you, it's a bit scary lah. So you just have to be less threatening, we're equals, let us talk. Sort of.
I think Dr. Teo, it also shows that as if we are always right. You know, macam ya parent to child. So macam as if telling I'm always right. So you have to listen to me or something like that. Sedangkan with a dementia person, we have to listen to what they need. Bukannya it is according to our needs. No, it's actually to dorang punya needs. Okay, I want to share one lagi, Dr. Teo. We actually have to bagi diorang ni good feedback, positive feedback. Macam us jua. Kalau sekiranya we do something, so kalau sekiranya somebody acknowledge and somebody actually give feedback, I mean, we would like it to be a positive feedback. So it's the same. It's the same for orang yang ada dementia. They will love it if they have if we actually give positive feedback, and then at the same time we can always give them words of encouragement, because we want them to be active, you know, physically and also mentally. And then how we do this is in a calm way, be very gentle and in a kind way. Jangan pula memuji itu tapi muka marah, you know, it doesn't sound right, it doesn't seem right to them. It's not right anyway. Jadinya that is important. Okay? Anything else, Dr. Teo?
I was going to also say, like, you can give what sounds like positive feedback, but it's you give it as well, and then you can give rewards. For example, if I say, "Oh, very clever," it's like it doesn't mean clever if you put sarcastic tone, for example. They can actually tell these subtle things. And we try not to give negative feedback. That's the difference with kids. Kids, you can say, "Oh, you've been very good, we give you a present," or "That's very bad, you're grounded." But then this sort of thing for older people generally, because let's say like you say, "Don't do this." Then what am I supposed to do? You need to tell me what to do, not just say, "Don't do this, don't do that." I can't think on my own. It should be the next step. I'm just aware that time's running short. The last thing about BPSD I want to mention is medications. Well, before we go on to questions, I think there were some. So medications is something which we can prescribe for people with behavioral psychological symptoms of dementia. So I think the first week I talked about medications to increase a person's cognitive ability. So it just gives a bit more neurotransmitter to the brain so they can think better. But sometimes when, especially our psychiatry team will see a lot of these behavioral psychological symptoms, we'll give patients to take the edge off the agitation. So sometimes antidepressants help, sometimes antipsychotics help. The antipsychotics is, it won't get rid of the irritation when they're being irritated, but it takes the angry stress a bit more out of them, so that it is a bit more manageable. But what we talked about this whole few minutes of how to approach it will still be valid and needs to be applied. Sometimes people ask me, can I just have medications to stop them from shouting, or just give us medication so that they will sleep all night? So there are a few things, issues with that. The first thing is, especially for Parkinson's patients, their sleep center is already affected by the dementia. So the sleep center is not functioning well, so the medications won't work. So I have some Parkinson's people who they will stay awake for 2 days. Then the third day they sleep. Then after that, I have some people who they just sleep 1 hour at night. Then you're like, oh my gosh, why can't this person sleep? The medications will not work because the brain center, sleep center is not working. So we just have to put up with it. The antipsychotics, the one to make people less angry and aggressive, there is a problem in that in the studies, when people are given the antipsychotic, the medication, and the other group are not given the medication, the one who were given, the group of patients who were given the medications tend to have shorter lifespan. They tend to get shorter. And so every time someone comes to see us in clinic and say, I just want medication to keep this patient well behaved, I have to disclose that actually, if you can manage it, I would rather you do that, because this medication can potentially cause heart problems and a shorter lifespan. Having said that, if the medication is needed, for example, the person's so aggressive, I can't even bathe them, I can't keep them clean, so they're soiled in their urine and feces. Then that one, they will get disease, that one is a terrible way to live. Then, of course, we will agree to give the medications in those severe situations. Otherwise, we try not to give the medications and try to make do with the approaches, Erna, you shared just now, some of them. So we try to do those as long as possible. And then we have to support lah. So if you are a main caregiver and you're tired, you're hungry, you haven't been to the toilet for a while, then of course the caregiver is also another person who we need to look after. I think that's all I wanted to say on medications. It's a small aspect actually of management. And then we better try to answer questions.
And I think, Dr. Teo, it's important also for us to look at things through the eyes. So maybe they get scared easily because dulu, past experience, sometimes they can reoccur again. And then maybe because they don't know what's happening, or they don't understand, or they're confused of the situation. So important is we have to look at things through their eyes. So it will be easier for the caregiver to take care of them. Are we actually trying to answer questions, Dr. Teo? We have questions, right?
I think there've been which I've lost track of actually.
Yeah, I think Umi can help.
Yeah, we have about three questions.
Yeah.
Okay.
Okay. The first one is from Nabila Haji Ali. Why do dementia patients get worse at night? I think it relates to the term sundowning.
Yes.
Yeah.
Yeah. So as I mentioned earlier, when we are tired, we just can't think straight sometimes, and so they just need rest, and then they just need to rest and recover their brain function. I think a lot of people notice this. For example, shift workers, when they don't sleep enough, they just can't think by the end of their shift. So for doctors, for example, overseas, we don't force them to work more than 24 hours. Otherwise, they look after someone who is sick, they can't think straight. That is a concern. and some people have had. So sleep is very important, and rest is very important. Not just for people with dementia, for all of us. Mothers, they say, have mother's brain, and so when they have look after kids and they don't sleep so well, suddenly the mother say, "Oh, I've got mother's brain. I've been quite forgetful." Again, sleep is quite an important aspect of making sure your brain works well.
Yep. Yep.
Okay, the second one, how do you handle dementia patient who has split personality syndrome?
Oh.
I'll pass it to Erna.
Personality.
For me, orang yang ada dementia ni pun sebenarnya have personality issues je kadang-kadang Dr. Teo because at the moment masa ni maybe ia pun confused about himself or herself. It doesn't even matter diorang ada personality disorder kah apa, tapi memang diorang pun ada andang ada macam tu lah, because they don't remember, sometimes they don't remember who they are now, tapi they remember who they were. Okay, 30 years ago. Okay, for example, an example that I can share, barangkali that person used to be asgar, ataupun business person. Jadinya masa ni memang ia ingat ia masih macam tu dulu tu. And also ia masih ingat bahawa ani-ani yang kan dibuatnya. How to handle is, again, it berbalik kepada ketani, we have to accept them of who they are. Sebenarnya they have apapun, penyakit-penyakit lain pun. We have to sebenarnya accept them of who they are, and then that will sebenarnya make it easy for us to handle ourselves sebenarnya. Because the challenge ni with a dementia person sebenarnya is ketani, it's how do I say this because it's a journey macam we know that this person is a loved one. Okay, it might be our spouse, might be he or she might be kita punya nini, kita punya keluarga. Tapi we know that this person cannot be macam ia dulu. So what do? Kan kita can deny. If we are denial, so it will be very, very difficult for us to handle even. So maknanya we have to what you call macam don't have issues in us lah. So we have to clear our conscience, jangan tak ada queries in our head. Macam mana, kenapa tak orang ni macam mana, kenapa tak mama macam mana, all of that buang tiap. So meaning to say, we cannot deny yang orang ni macam tu, but the way we approach dia orang tu is actually the best sudah. For example, kalau myself, I don't know how to approach, we have to try, because we kenal ia lebih daripada orang lain. A doctor cannot tell you what to do, because this is a learning process. As we mentioned sudah dari awal, what we do today might not work tomorrow. So this is a way supaya kita ni tu belajar as well untuk macam mana kita ni kan approach ia. There must be caranya, and untuk kita ni membuat is kita ni mempelajari. Okay, this doesn't work, it's fine. So we try again, another approach lagi. Okay, so I remember Maizatul was telling about dia punya tua kan, mula hatu memang kalau kita ni approach ia dah bercakap apa. Yeah, it doesn't matter. Jangan kita ni lihatkan muka kita ni macam mana, So it is how we approach sebenarnya, and how accepting kita ni dengan keadaannya. Okay? I hope that answers it.
Can I ask, in terms of split personality, I'm not really sure what that means, but I think if my interpretation is correct, the person like suddenly change in terms of behavior suddenly, and it's a bit predictable. Actually, I don't know how to describe it, but life is just like roller coaster of emotions, and for us it tends to be a bit more static, whereas for people with dementia, the roller coaster is a bit more up and down, up and down. So for example, I don't know how your day was today, but let's say in the morning, maybe Erna had breakfast with family or something, then happy. And then, but people with dementia, it's not controlled. So maybe suddenly they're laughing, they're very, very happy. Then after, I think Erna had a meeting or something, quite frustrating, probably in the meeting, or it was productive, depending on how you look at it. So if this was a person with dementia, suddenly frustrated, suddenly there's another roller coaster. They were laughing like anything this morning. Then suddenly new situation, you get all this angry. It's like a totally different person. And for this split personality, actually, like I said earlier, they're showing their original emotion. And it's just fluctuating a lot. So it looks like suddenly change person, suddenly change person. So again, the concept of trying to figure out what makes them go through this roller coaster of emotions is quite important. And then the split personality change to someone who is irritated, you need to really figure out how to remove all the things which are irritating. Or maybe like at that time, it's lunchtime or something like that, and they're always hungry at that stage. So maybe you need to put something in to pace them out to make sure it's a bit smoother. If the interpretation of split personality is correct, I don't know whether that answers.
Ada question lagi Umi.
There's one
That's why I
comment.
think okay, continue Umi.
From Ali. It's often stressful because I know their behavior is not intentional, but I would still become annoyed when I know I shouldn't. So maybe you can give some advice.
Oh, okay. So this is what I've been telling tadilah. I keep on saying it because one thing kan we have to deal with our own issues. Sometimes you know, everywhere people know it is not easy. As a caregiver, it is not easy. Okay, tapi I assure you, memanglah people won't understand. Because like di Brunei ni, istilahnya kalau anda terdapat, anda faham macam tu. And sometimes people memang will obviously say, kau jagakan mama mu tu, lakat je lagi ulahnya macam tu, you know. So if sekiranya benda-benda ni, it won't help you. Tapi you are the one who is facing all of it. These things yang negatif ni, you should not focus your energy on. Pasalnya you need your energy untuk jaga whoever yang ada dementia ni. So it is something that you have to accept. People will obviously cakap lah, we buat bagus, anda buat bagus pun. I mean, we buat bagus, of course, it won't probably ada result yang good. Because we don't expect the dementia patient need to be okay all the time. Alright, so that's why I say it is important for us, any caregiver yang menjaga orang yang ada dementia ni, to open up and to not give up. Sebabnya once you give up, you will definitely, I mean that's the end. Macam itulah. Tapi ya berdosa ke tani jua, because yang ke tani jaga ni kadang-kadang indung ke tani sendiri. Because I have a case, maybe masih ada masa kan, I have a case yang ia adik-beradik ramai tapi ia jaga seorang. And the other siblings ni mengucapkan, nya berapa tahu kan bawa mama macam tu. Nya aku concern. You see? So you stick to your pendirian itu. You have to stick to that. Sebabnya itu yang can help your mom or whoever yang ada dementia tu. There must be somebody yang benar-benar menjaga ia and believe that this person still needs the attention, needs to have love. Siapa bagi ia kasih sayang apa tu, you know, things like that. So if sekiranya you have macam lurus ke apa yang ku buat ni, ataupun I don't know what to do again. So don't worry, reach out to Dementia Brunei. DM kami punya IG ni. So reach out to us, you know. We can help. I mean, it's sekarang ni everywhere di Brunei, ketani memang ada tu caranya untuk ketani reach out to people. So now we have IG. So jangan malu-malu. Just reach out to Dementia Brunei. We will help you. Itulah. So whatever it is, one thing I need to remind myself as well. We have to think and see through their eyes, you know, untuk memahami diorang. And so that ketania tu kurang sedikit rasa stres ketani. Dan what people say ada beban tu tadi. But it is not beban. If ia indung bapa bis kita sebenarnya is spending your time, spending dia punya time, awal lahir dia akan meninggal jua. So quality of life sebelum ia meninggal, that's the point. Okay, you want to add something, Dr. Teo? Because for me, the end stages of dementia patient ni is very very challenging for the caregiver, yeah. So even for the doctors, kalau sekiranya akan memberitahu orang ni, mana yang beritahu orang ni akan meninggal ni, mana yang beritahu macam tu, dia akan beritahu dengan cara yang psychologically the caregiver will accept, but it's not easy for a doctor even. Yeah.
Yeah, I think the only thing I have to say is it is challenging for everyone, not just the
Yeah.
kid. And when you say you have to check that the person with dementia is okay, it's actually not just the person with dementia, it's everyone else around them. They need support as well. And then that applies to not just people with dementia and the people around them, it's also, well, everyone else, our friends, our family
Yeah.
members. So it's just
Yeah.
something which is generalizable, these concepts.
Yeah. I hope that helps.
It does. I can't. I
And we
don't
have
know
more
what to add.
time, or
Yep.
because there's actually more questions.
Oh, really? I did not see. Macam mana, Dr. Teo?
Mana saja. You want to continue or we put another session?
What is the question, Umi?
Yang recap from last week from AJ Kurhatla.
Oh, okay. We'll
Yeah.
go quickly
Okay.
lah, maybe 10 minutes extra. Oops, extra long.
There's about 7. Okay, the first one is our complaint for my family would be my mother being defensive atau yang bagi stress, and her persistent on to do the cooking walaupun tunggang terbalik sudah, and at one point she was adding the sabun glow cuci piring to her cooking. Maybe that one first.
I think Emily covered the steps that she needed to do to be able to manage to cook. I think it's very difficult when you cannot really get the correct messages into your brain in a person with dementia. So I don't know what this poor person was thinking when they put soap in their cooking. Maybe they misread it. It was soya sauce. I'm sure you've accidentally put like salt instead of sugar before. That's nothing to do with dementia. You just made a mistake. And so the way in which we recommend is to actually try and make it as easy as possible, but you try not to remove them from doing the tasks, because if they do, if they stop participating in activities, their memory function will get worse. So it's actually important to make use of your brain function for as long as possible. And so for this person who has mixed up some cooking, maybe you can help giving recipes, make sure what she wants is available. The things which shouldn't be there should be removed. If they have visual spatial difficulties and they cut themselves, maybe you help with doing those tasks. But I know a lot of people with dementia, especially in Brunei, especially the older women, they still want to cook actually. And so I know sometimes they leave their stove on, and then family members say, one mistake, no more cooking for you. That is quite harsh. Actually, they need to maybe just have supervision to remember to switch off the stove, for example, but they can still continue and try to do it.
And then the next one, we even have big manila cards posted around the wall, the do's and don'ts for my mom, tapi still masih je dibuatnya. How to tackle that?
It's the manila cards don't really necessarily help if they can't read or understand the messages. So for example, last week, there was a vending machine, and then, in hospital we have vending machines. So I tried to put my money in. Then I tried, and then it just wouldn't work. It just wouldn't work. Then I'm like, why is it so frustrating? And I got a bit irritated. Then one of the people who walked past was like, oh, actually there's a sign at the top in the front which says, we'll come back in 30 minutes, don't use the machine first. And then it's like, there's so many things in the front that I didn't read it. So it's not like there's no sign. It's just I didn't see it. And then I don't know whether you've gone to the how to say, kedai runcit, and then there's a lot of signs, like they say we want to find help with, if you need help with cutting grass or something, there's tuition, there's all sorts of signs. How you find what you want in that mess of everything, it's actually quite difficult. Language, sometimes people with more advanced dementia, they can't really read as well or understand the messages. Just like when Erna, you said, when people WhatsApp me, I can read very well, but sometimes I still misunderstand what has been written down. So the Manila cards, maybe they can't understand, or they selective reading. Like when I was looking at the vending machine, I was looking at what I want to buy, not the signs and everything else. I mean, when you go out, you don't read everything which you see, right? You are all a bit more selective. So probably pictures may help. Maybe verbal reminders, because some people are just better to hear rather than read, for example. Because I know currently we have a lot of new SOP, and then they send me all these emails. It's easier if someone just tells me. I don't want to read all these things. Do you know what I mean? And so that person may just find it easier to hear rather than see. Some people learn better by touching and feeling and doing. So it's the same concept to people as well when you want to teach them things.
Can I suggest something? Barangkali kalau sekiranya Manila card yang pakai words does not work, maybe can use pictures. Maybe with having pictures satu, ia barangkali lebih lagi dapat menerima, because probably ia tu visual person lah tapi untuk macam Dr. Teo tadi kan, walaupun he was selectively reading, tapi ia akan melihat apakah di balinya saja. So probably that person ia melihat tapi dia dapat olehnya. So maybe we can try using pictures, try that one lah. Mana tahu menulong, because with them ni we have to cari ways. So it's a time for us to be a bit more creative lah sama bis orang anek. Okay, we just try it out.
The thing is font and the color contrast. Some signs are just difficult to read. And then I don't know whether this person is visually impaired. But then if I remove my glasses, you put a sign in front of me, I also will ignore it and I can't follow because I just can't see, for example.
I mean that too, and probably ia pun payah sudah figure out, because maybe ia sudah kena that area where ia bercakap, ia membaca pun sudah payah. So having pictures probably would help her more lah, macam tu.
Agree.
Try it out lah.
Yeah.
Ada lagi Umi?
Ada lagi. And how to handle her clinginess towards my father. My father is a stage 4 cancer who is now in his advanced stage. My mom keeps on nagging, balik-balik bertanya, which make my dad stress. So we try to caraikan my mom, bawa jalan-jalan so my dad can have a bit of time, a bit of his time in peace. But she end up lari kadang-kadang. What can we do?
Well, Erna is a bit clingy just now. What do you do to him?
Okay. This situation is quite difficult lah. I mean, I can assure you it's not easy lah. But one thing, macam tadi kan, my son keeps coming here actually, I was actually resisting him. Tapi he keeps coming. So, if sekiranya you resist, ia akan semakin pulang mengagak. Okay? So, that is sebenarnya the challenge because that is what happens lah. Kalau you reject, then ia makin terpulang lagi tu. Memajal jadinya macam tu kan. So, macam tadi I tried to hinder him from coming up here supaya konon-konon lah it does not interfere with our life ni. Tapi obviously he kept trying. So I have to like sit him on my lap tadi lah. So lepas satu ia sendiri lari. You see, sometimes kayaknya yang kesiannya your father the father ni ia ada cancer, and probably masa tu lepas dia chemo barangkali, and then memang anulah ngalih macam tu So in this situation, kalau ia mengagap pun, I think anak-anaknya lah habis kita yang mendangani your dad, you know. Because actually we don't want to pisahkan diorang. Okay? We don't want to pisahkan diorang because ia indah ingat betul. Tapi what she remembers is your father. So her spouse yang paling ia ingat, why ia kelingi? Because ia sayang. So sometimes we have to accept the way ia macam tu kan, and then mencaraikan tu, it might work, tapi memang ia mengajar kan, ia lari kan, because it is a need, ia punya need. So once tadi we talked about unmet needs tadi tu. So kalau ia ada unmet needs tu, takut sekarang ia lebih teruk lagi. It can deteriorate cara ia berfikir lagi apa itu ini. So try as much lah and then menasihati juga your father, walaupun dalam keadaan macam tu, you guys are around untuk mendangani your father. You know that your father tu ngalih macam tu, tapi it's the way it is. Okay, so it's the way it is. Ia mau macam tu, not to the stage where ia memukul lah macam tu, being aggressive, then that one mesti je tegas lah macam tu, but in a very subtle way. Kemari kita mak macam tu. Mak tadi kita kan buat ni, you know. Sometimes we have to distract them dengan whatever. You see, mak kita ni kan masak ni jua, you know. Diorang memang dah ingat sudah. So you just make up things supaya yang daluan mengganggu your dad. Jangan try to caraikan itu in a way that you are very defensive, you know, dengan cara yang kasar. It's not a good thing to do jua. Because you the only thing she probably remember is your dad. So memisahkan it's not a good term to use, tapi kirakan mendistract saja. Okay? So distract saja ya. Ma, dengan ni aku kan minta tolong dah, ku ingat resepinya. You know, things like that. Make up things. And then, ma, adakah something yang bertulis? Ini dari doktor, mak. Dr. Teo ni. Kata Dr. Teo, jangan kacau bapa. Kalau bapa ngalih, you know, macam tu. Because diorang have to see the evidence and you have to convince habis diorang tu. Alright? So we know that memang caregiver ni perlukan masa diorang sendiri. And this is where it is very important for the siblings to understand. Kalau the caregiver burden tu seorang saja. Because diorang tu ada masa. Respite for them is something difficult to do. And then Anita lagi time COVID macam mana ni, payah dia akan macam bersuap. Sedangkan anak yang lain tinggal tempat lain. You see? So we have, jadi caregiver ni is very difficult lah, very challenging. Tapi pahalanya tinggi kalau siapa yang ketani jaga tu indong ketani apa. So, I say, sometimes people say macam mana? Sabar ku ni ada limit. Okay, sabar ku ada limit. They say that. Tapi hakikatnya, sabar ni adalah satu istilah yang ada limit. Who limits it is us. Ketani yang melimit sebenarnya. So maybe that is something for us to think about lah. So sabar ketani itu sebenarnya ketani sendiri yang melimit sebenarnya. Alright. So for this situation, memang Dementia Brunei, Persatuan Dementia Brunei pun we know that we realize that memang caregiver ni is a very very important component dalam dari segi menjaga kesejahteraan orang yang mempunyai penyakit dementia ni. And we realize lah that memang perlukan masa sendirian. Sebabnya kadang-kadang macam Dr. Teo cakap tadi, kejamban pun 2-3 jam indah kejamban macam tu. Tapi yalah we try as much. Macam mana pun dalam keadaan itu kita ni harus be very patient lah macam mana pun. And then if sekiranya you need to like rent everything, you can call your best friend ke apakah, at least you share it with someone. Sometimes caregiver pun dia lagi tercakap tapi you need that. And now we have 145. Kalau sekiranya akan bercerita, they can talk therapy you. Alright, and again counselling di Japim pun ada. You call 233-3141 to get a counsellor or to get somebody to talk to. Alright, so these are the things that you should do. And then try it out. Maybe there are things yang you haven't tried to do tapi ada di sana, you know. Look at the pattern. your mama tu bila, clingy, things like that. You need to know that. So research sedikit. And then your dad, apa yang dapat ia buat at the moment your mom clingy tu. Those kind of things. You can plan a lot. Alright, but never give up. Okay? You want to tambah, Dr. Teo?
Thanks for the resources. I didn't know you could access counseling services and things like that.
Yes, you can.
In terms of the situation which the question was raising, the person wants to see their spouse and things like that. Actually, I want to use Erna and her son as an analogy as well. So when he came over, he probably just he's after something. I don't know whether it's company, he's bored. It's like, oh, mom's playing something on her phone. She's been at it for goodness knows. Must be something interesting. I also want to check it out. But I can tell you, if you give him what he needs in a different way, like, oh, there's nothing, this is just a talk, he'll probably go away. Or he's just bored, he just wants attention. I'm sure if his cousins are there, he also will go away. He won't disturb you for hours, for example. So there's an unmet need. And for some of the needs that we have, you can substitute it with other things. For example, like with COVID, very hard to see your family members. But do they actually need to be there? Maybe they just want to see the person. For example, my parents, they want to see their grandkids, and then so we video call them, and then they can see, and then they're happy. It's a substitute. Maybe they just want to see them, or maybe they just want company because they're bored, for example. Then they don't actually need the husband to be there. Maybe if they just need someone to accompany them because they're like, oh, I'm on my own, I need company, I need someone to be here, I'm lonely. Then it doesn't really need necessarily the husband, for example. So you have to try and substitute what the actual need is. If, let's say, he needs to rest, then maybe I've had couples who they don't need to talk, they just need to sleep next to each other, and just the presence is what makes them happy, in which case it's okay also. So we need to figure out whether it's a component of that person or what else it is that they need, and then you try to substitute lah. But certainly if they're married, it's going to be difficult to separate, I would say.
We have last two questions, if that's okay.
Oh,
Okay.
Yep. Is dementia hereditary, and how dementia can be prevented? That's it.
Sorry, my internet was a bit slow or lagging.
Yeah.
The first question was, it's dementia hereditary? Yeah.
And how dementia can be prevented? Number two.
Oh.
Yeah, so dementia, there are some gene things which run in family. So there's some genetic conditions which can increase risk of dementia. Down syndrome is one, but Down syndrome just happens randomly in the population. Whereas some families, there's a few people with young onset dementia. There's probably a gene coding for some of the brain functions which is affected, so they're more at higher risk. But for most people who are older, it's not a genetic condition. So when I have a person who is 80 with dementia, I don't tell the family members, do genetic testing in case you get dementia. Dementia itself, when we get older, there's a higher risk of developing it anyway. And so unless it's someone who is very young, like someone Emily said there's someone who is in her 20s who got dementia. If there's no condition which caused it, like Down syndrome, for example, they will have to think, or if there's a few people in the family who have young onset dementias, we have to think about doing genetic testing, which we haven't done until now. Yeah, but very rare. And for older people, it doesn't necessarily mean runs in the family, though when they get older, it could be dementia. And then prevention. Prevention, I think I mentioned it in the first week, where you have to try and optimize brain function. So education, making sure you use your brain a lot, managing your health. So when you're 40 and above, you need to check your blood pressure, cholesterol, make sure you don't have diabetes, because those things predispose to dementia. So treating those reduce your risk of dementia. People with car accidents who have injuries to the head, they're high risk of getting dementia. So wear your seatbelt, don't drive too fast, Those sort of sensible recommendations apply. And then for older people, you need to be physically active, mentally stimulated, and you try and keep company and social interaction. Those things slow down the risk of dementia.
Yeah. And also maybe we can highlight smoking, Dr. Teo. Kalau
Yes.
sekiranya orang yang bersigop, they have a higher risk of getting the dementia. Itulah. Yep. And also we mentioned this a lot. What's good for our hearts is actually good for our brain. So we jaga our food intake, because sometimes we don't understand there's actually a connection between what we eat now to what we become when we're a bit older, right? So we have to watch out for our food. And although we know that in the food pyramid, okay, so we know all of that, so we maintain lah kalau dapat a balanced diet, so it will help. And also exercise, Dr. Teo, tadi mesti exercise.
Yep. Balanced diet is actually quite interesting because I don't know whether you all have seen Healthy Plate. Healthy Plate is like
I've seen it.
so it's a round thing. Half needs to be veggies, a quarter is rice or carbs, and then a quarter is protein. I think in Brunei our half is rice, and then maybe veggie is less than quarter, but veggie should be half, and then rice is only a quarter, and then protein is a quarter. Sometimes we get like rendang with rice. It'll be like lots of rice and then lots of meat.
Yeah.
Then there's no veggie, whereas it's actually the balance. So Healthy Plate, I think, is something which we're not used to. I'm also struggling with the Healthy Plate because of my upbringing here.
I think not only you, Dr. Teo. And maybe later on, maybe we can include that in our IG feed, all right? About healthy plate. bukan happy plate. Kalau happy plate, things that make us happy. So banyak dia yang unwanted. Okay. So is that the end of the questions?
Yeah. Can we wrap up soon?
Okay.
Yeah.
Yep.
Okay. So to wrap up, we hope now the viewers, now you can understand what is BPSD all about, and we would like to say thank you to Dr. Teo and Ms. Irina for giving us your insights and knowledge and your experience about BPSD. So to the audience, if there's any more questions that you would like to ask or you need some advice from us, please don't hesitate to contact us via social media. And before we end the session, we have an announcement to make. In early September, we have mentioned that we're having a giveaway, and so we will announce the winners tomorrow on Saturday at 2 p.m. So stay tuned. Okay,
Wow.
we will end the section by saying our slogan.
Thank you, Nah.
Yeah.
Very good.
Our slogan, sayangi orang muda, hormati orang tua, kenali demensia, no Alzheimer's, and teranah di rumah bersama melindungi. Please take care and stay safe, everyone. Thank you.
Thank you, Umi. Thank you, Dr. Teo. Thank you for the viewers.
Thanks, everyone. Have a good weekend.
Bye.